So Claire, again, coming from Peterborough District Health Unit, share with us some of the experiences that she has, in particular, working across a number of health unit areas to support her school board relationship. Over to you, Claire.
Great. Thanks so much, Tammy. Okay, so yes, I'm here. Here to represent our joint district school board and local public health agency collaboratives. So I'll be talking a little bit about our structure and some of the things we've been able to accomplish together, and some of the successes, and as well as some of the challenges. And hopefully that resonates with you. And similar to Emily, I'll share my contact information, and if I'm happy to connect with anyone who finds anything that they'd want to discuss further. So as I said, we have a collaborative, and it currently consists of 4 health units. So we got Durham Region Health Department, Halliburton Kawartha Pine Ridge District Health Unit, Hastings Prince Edward Public Health, as well as Peterborough Public Health, which is where I'm coming from. And then we have our 2 local district school boards, Kawartha Pine Ridge District School Board and Peterborough, Victoria, Northumberland, and Clarendon Catholic District School Board, quite a mouthful, as well as our French board, Mont Avenir. And so it is a very vast and big group. And I do just want to note that we only recently downsized our group membership this school year. Prior to this, we also had Simcoe Muskoka District Health Unit and Trillium Lakelands District School Board sitting at the table together. So as you can imagine, that's a huge geographic region and several boards and several health units to try and organize. And so we did narrow it down just to the ones on the screen. To fall in line with the MOU that we recently had signed, and we just find it's working a little bit better. But I just wanted to acknowledge that you can do this with a big group. So some of the opportunities and successes of this collaborative. So I'll start with our opportunities. So COVID-19, while this may seem counterintuitive to have in the opportunities slides, having a common issue. So how are we going to keep the students and staff as safe as possible while in the classroom? And having something that wasn't arbitrarily defined by a geographic region or boundary, it really did help us to rally together and further enhance our already existing and strong relationships that we had with our school board partners. So the silver lining is that the pandemic actually strengthened our working relationship between the health units and the school boards. So that's something definitely to be celebrated. And as I mentioned, having a signed MOU, I'll go into a little bit more detail in the next slide, but having an MOU that's a formal agreement in place to solidify the importance of us working together, as well as allowing both health units and school boards to dedicate staff at the various working group and committee levels. That really was pivotal to our success, as well as leveraging windows of opportunities and our connection to curriculum. They definitely go hand in hand. So our communication goes both ways. We talked about the reciprocal nature of the health unit and the school board sharing. And so we as health units would approach the school boards with programs or initiatives, or if we found data or trends surprising or worrisome, that we would approach them with programs and that would be mutually beneficial, and tied to curriculum. So vaping cessation programs. We're doing the recently revised PALS resource, so the physical activity leaders resource. Food literacy programming, and much more. And at the same time, they approach us. So the school boards were approaching the health units with needs as they arise. So respiratory illness communication, support around immunization. The most recent one is the school board's wanting support around the solar eclipse that's happening in the spring. And so reaching out to the health units and asking for support, and then we in turn can do the same thing. So it really is just knowing who to call, who to pick up the phone and say, hey, we have a problem, or hey, this is something that's come across our table. Are you finding that's happening in your schools or in your region? Okay, how can we support you? And then we come up with a plan. And then opportunities to collaborate at various levels. So with the MOU that we have in place, we have dedicated staff to work together. And so we have regular meetings at all levels, from the top down to the bottom up. So our medical officers of health and our directors of education across all the health units and the school boards that I listed before, they meet 3 to 4 times a year. And then at a management level, we have the communication managers and the school health managers at every health unit and school board. We meet every other month. And then at the staff level, we have committees and working groups. For example, a joint mental health subgroup working, and all those committees are connected, and we filter back to each other so we know what's happening, and we can have that informed planning process as we move forward. And so I mentioned COVID-19 as a silver lining, and I won't go into too much detail on this, but it's just surprising, and it's amazing to me what you can accomplish when you're able to come together. So as most of you know, COVID was a trying time, and we really had to work with our school boards to think about what the protocols were going to be that we were going to implement, how to interpret the regulations that were changing every day. And so for our collaborative, over those 2 years between May 2020 and June 2022, we met 71 times. And so that was no small feat. And that doesn't include any of the subgroups we established throughout that process as well. For example, as I talked about, the mental health support and wellness in schools. And just some quotes that we did an evaluation of the committee in spring of 2022. And the committee members felt at that time that it was integral to be able to navigate the challenges faced by the ever-changing COVID protocols and restrictions, and having the opportunity even just to come together face-to-face, virtually face-to-face, to share ideas and jointly develop resources such as the flowcharts to support each other on a regional basis, while taking local trends into consideration, was invaluable from the feedback that we received. And I mentioned the Memorandum of Understanding, or the MOU, and that is really, I think, having a signed MOU has been a key ingredient or factor to our relationship with the school boards. With this formal process in place and buy-in from senior level, it set the stage for our continued relationship building and collaborative work moving forward. So as we transitioned out of our COVID-19 response onto more broader comprehensive school health initiatives, there has been unanimous agreement. The committee members felt that these meetings are important, and that we have commitment to support student well-being at various levels. So the school level, at the student level, at the community, and then board-wide. And we tried to operationalize our MOU by having platforms to share information and do the joint initiatives. And so just some examples of what we were able to do. It's a little bit different when you're working with several health units and different school boards. I'm not going to highlight specific programmings that we were able to do, because there's several that have happened between each health unit and the school boards. But as a collaborative, we were able to really come together on specifically around joint communication and consistent communication, which I know that our school board partners appreciated, because when you're working with different health units, we all have different approaches of doing things. So they did appreciate having some consistency. So whenever possible, we try to be consistent in our approaches. We were able to collaborate on our comprehensive school health assessment tools this year. So when we're going into the schools, we're all working from the same tools. We are right now trying to work on a board-wide PD for educators around vaping. I think that was mentioned earlier around the provincial funding. So we're trying to be consistent in the approach that we take around that. It seems to be going well. And so having the proper mechanisms in place and knowing who the right individuals are to contact, we were able to quickly and seamlessly be able to share information to students and families. And so an example of this is around our ISPA, our immunization enforcement activities that we restarted this year. So for the first time this year, we actually did a little bit differently. And for Peterborough Public Health, we focused on our grade 10 students. And so we've never gone into the high schools prior to COVID. And so I was able to pick up the phone and call, and we were able to get the clinics set up, and it was really seamless. And it was because of those relationships that we had created that allowed me to do that. And so at the same time, we also wanted to ensure that, we were setting the students up for success, and we wouldn't have all these students who were going to be suspended. And so we worked on a plan with our superintendents that they would also, because they had the relationships with the school principals and the school administration, that they would then amplify our messaging, and they would reach out to the schools, and they would communicate about the importance of, the students having to know where the clinics are and what the outcome would be if you were going to be suspended. And so having the communication come from various levels seemed to work quite well. And we actually were able to, all of our suspension notices were rescinded for that grade 10 cohort, which is absolutely amazing. So we didn't have any students suspended. So that was a great success of our collaboration. And then on to barriers and challenges. So competing priorities for both the school board and the health units always seems to be an issue. We have lots of mandated work we need to do, and I think it was mentioned before that we as health units are mandated to work in with school boards. It's not quite the same with the school boards back to us, but they definitely see the importance of working together as a collaborative. So that while it has been a bit of a barrier, it hasn't really set us back too much. Staff capacity, both from the school level, educators and staff are stretched thin, and local public health agencies are also struggling to meet our mandates with limited resources. We're also living in a very uncertain time right now with the Ontario Public Health Standards Review and potential mergers that a lot of the health units are considering. So that
capacity, it continues to be a challenge when we're working together with our school board partners. And consistency. And while this is a strength for partnering, it can also pose a challenge when you have 4 or 5 different health units and 3 and 4 different school boards trying to work together. We all do things slightly differently in terms of processes and approvals and approaches, and our capacity is different. And so while this isn't unsurmountable, it does make things just a little bit more challenging when you're trying to work in a collaborative such as ours. And I don't like to end on a negative note, so I'll finish off with this quote. We talked a lot in our programming about the importance of relationships as a protective factor for health and building resilient individuals, families, and communities. And I think the same is true when we're talking about our school board and health units working together effectively. Relationship building is the key to success of any collaboration, and I really do think that's poised as well to have the success that we have had in our regions.